who I think are the best anti-inflammatory supplements for inflammation. I'm a huge fan of turmeric. My joint health multi is turmeric, piperine, ginger, and PEA. Turmeric's just awesome. You should take it anyway for heart health, gut health, just health. I take it for personal wellness, but it is awesome for knee arthritis. And it's been studied head-to-head with anti-inflammatories. Ginger's been studied head-to-head with anti-inflammatories, and they are as effective, if not more, much more natural, much safer. So I love when people tell me they're taking turmeric, and I know they've got a great chance of getting better because they're already on the right track. So PEA, I love this molecule, palmitoyl ethanolamide. I learned about PEA in my research on CBD and medical marijuana. It's a similar molecule to anandamide. These are fatty acid amides, okay? Anandamide is the Bliss molecule, which is what CBD upregulates in your body. Palmitoyl ethanolamide is just another one. They both act synergistically to reduce the levels of FAAH, which is the enzyme that breaks down anandamide and breaks down 2-AG and the other ligands or keys to the endocannabinoid system. So think of PEA as an analog to CBD. It works just the same way, but it's not derived to the marijuana plant. PEA is actually produced by you every time you get hurt or injured. Your body upregulates the amount of PEA to reduce the inflammation around nerve endings. We're going to talk about that in a minute. But PEA basically attaches to the same receptors that CBD and THC do, the G protein coupled receptors, which there's a gazillion in the brain. Well, not a gazillion, but you know what I mean. And then the peroxisome proliferator activated receptor. So this is a genetic modulator of inflammation, hugely important, and PEA modifies that to your benefit. And it's all natural. It's a great molecule. You make it yourself. We just don't make enough because our diets are so terrible. We don't exercise enough, and we're surrounded by pollution. So I help myself out and take PEA every day. Next. And PEA is well known. It's used in Europe all the time as sort of a prescription to treat arthritis, neuropathic pain. It's been used for, 60, 70 years, very safely, extremely safe. This is sort of the circle of what it can treat and very effectively. So I use it a lot for inflammatory pain for people. We have it in our topical pain cream too, because it reduces that hypersensitivity, the peripheral sensitization we talked about of inflamed nerve endings. And then you can just really use it for a lot of different conditions. You may say, well, how can something work in all of these different conditions? Remember, we're going to the root cause of all these problems, which is chronic inflammation and oxidative stress. I preach it every day, all day. That's how the Mediterranean diet works. That's how exercise works. That's how sleep works. And that's how natural medicine works. You're reducing chronic inflammation and you're reducing oxidative stress. Therefore, the root cause of all of these problems goes away. That's why I love all of this, because you can really, it's not Band-Aids anymore. You can actually get to the problem. So PEA is water soluble. It acts like CBD. We talked, it's been clinically tested. It's generally recognized as safe. It's anti-inflammatory, supports the immune system. And again, it's endogenous. That means you're making it right now while we're talking. Your body's probably making PEA somewhere for some reason. We just don't make enough of it.